Why is reflection important? Reflection is important to the cultivation of professional knowledge. Professionals use many forms of knowledge in healthcare practice, including technical, scientific, social, cultural, relational, practical, and self-knowledge. While we frequently focus on the technical and scientific knowledge base so important for professional work, reflection is equally important for the cultivation of other types of knowledge relevant for practice, what some people call epistemologies of practice, and for discerning how to apply the available evidence. Much of the knowledge professionals acquire is based on experience, and it is often so deeply embedded in the way they practice that they may not even realize it as a form of practice-based knowledge. For instance, when asked why they perform a successful task a certain way, experienced practitioners may respond, "I don't know, that's just the way I've always done it." In other words, they may have trouble putting words to their tacit knowledge. Tacit knowledge is often deeply embodied and difficult to articulate. Polanyi describes it as that which we know but cannot tell. Reflective practice assists practitioners to uncover their tacit knowledge in order to make it more explicit, so that they can recognize the repertoire of knowledge guiding their practice and take more intentional actions in the future. Reflection is also important because healthcare practice has become very complex, and we are living in a time where the quantity of information that professionals and students need to manage on a daily basis has exploded. Taking time to stop and sort through the various forms of information coming towards us is vital in today's rapidly changing and technologically oriented healthcare environment. Reflective practice assists healthcare professionals to sort through information, negotiate the confusing or complex situations within their practice, and to examine the context of practice from a variety of perspectives. In this way, reflective practice assists practitioners to gain a deeper and more nuanced understanding of issues and to discern the best course of action to optimize outcomes in practice. Reflective practice is also a requirement for many regulated health professions as part of their quality assurance programs. As a component of a quality assurance program, reflective practice often requires professional practitioners to reflect on their strengths and weaknesses through a self-assessment process and to develop a learning plan to address self-identified areas requiring improvement. The aim of this formal process is to assist health professionals to continually enhance their competence. Critically reflective practice can also be used to reflect more deeply on systemic issues, such as social, political, cultural, and economic dimensions that shape the practice environment. Critically reflective practice assists with planning for systemic change that makes a positive difference. Preceptorships offer excellent opportunities to engage in reflection. Preceptors and students can discuss surprises arising in the midst of practice and practice challenges together. Preceptors can model processes of reflection by sharing their inner dialogues with students, and preceptors can better help students to learn when they know what students are thinking about. Through thinking out loud, preceptors and preceptees can also make tacit knowledge more explicit and develop solutions that enable both to learn and grow, and that contribute to more effective health and social care environments.